All right, hello everyone. I'm Dr. Jeff Grosskopf, chiropractor in Wauwatosa, Wisconsin. We're just outside of Milwaukee. We focus primarily on helping people who have had spinal injuries or people dealing with chronic pain. Today we're going to talk about why your doctor stinks at managing your pain. Typically, pain management is where our medical system really breaks down. We have very few good options for people to manage pain here in our country. Most people suffer with chronic pain. Chronic pain is very expensive. If we just begin to look at the stats of pain management for people in America who are trying to manage chronic pain, the average medical pain management, which includes pills and injections and nerve blocks and therapies, on average is around $8,000 a year. That's someone with low back pain. We see the similar cost for people who are dealing with neck pain, chronic headaches. These are very expensive pain problems that people have. The reason is we just don't have great solutions. And I think doctors having to deal with chronic pain, it's one of the worst things most doctors want to have to handle in their office. Doctors want to get you better. They want to get you out the doors and not have to come back. That's why we become doctors, is we want to help people get better. Chronic pain is an issue because that, as a doctor, we see people who aren't getting better. So let's just review why I think people, or why maybe your doctor isn't great at handling your pain and essentially what you can do to help it out. So a lot of doctors, they just don't understand why you have chronic pain. If we were to look at Medscape, and you can do this on yourself, Medscape is just a research resource that tells you about chronic pain and what types of chronic pain people have. We can start to get an idea of why people have chronic pain. So maybe you have neck pain or headaches or low back pain, but the question is, what's the underlying condition that's causing that pain? The vast majority of you who are watching this, if you're struggling with headaches, neck pain, or low back pain, you have an undiagnosed condition of an injury or a condition with the ligaments of your spine. Again, if we go through the research and we look at what the ligaments of your spine do, we see that an injury or damage or instability in the ligaments of your spine will always lead to chronic pain. Your ligaments are what hold your spine together. In fact, your spine, it's two things. Your spine is bone and connective tissue. So the ligaments are that connective tissue. You have the ligaments around your spine that hold it in place, and you have the disc ligaments. And the ligaments surrounding your spine are the number one cause of the chronic low back pain and neck pain. And those specific injuries can only be found through a series of x-rays, and essentially you need a doctor who specializes in knowing what x-rays to do and then how to read them, where you can find these old injuries to the ligaments of your spine. Once you have the right diagnosis, you can do the right treatment. The problem is most people are just told, well, you have neck pain or you have headaches. Well, that's not good enough to treat a problem. Your diagnosis in those situations, saying, hey, you have neck pain, the diagnosis isn't the condition. The diagnosis is the symptom. So you need to get back to the actual condition. And for most people watching this who are struggling with the chronic pain that we're mentioning here, you likely have an injury to the ligaments of your spine, or at least a ligament of your spine that nobody's looked for, nobody's thought to look for. It's a matter of finding the right doctor who knows how to work that up. Even if you go to most pain doctors, a pain management facility, they're not going to even think to look for these injuries. And I know because I've been doing this over 16 years, and I get the patients that are in chronic pain who have seen the ortho, the neuro, the pain management, and these injuries are being missed. They're being missed quite a bit. And so you have to have the right diagnosis to get the right treatment. Now, most therapies that you're doing for chronic pain, they don't work. If you have an injury to your spine that's causing neck pain, headaches, low back pain, there's a few things that won't work and that are pretty popular. Dry needling isn't going to fix that condition. A cold laser is not going to fix that. Cupping is not going to fix that. Heating is not going to fix that. All of those therapies are just looking to put more blood flow into the tissue that's injured, which means over time you're creating more inflammation in most cases. When you have an injury to the ligaments of your spine, that injury has caused changes to the alignment and the biomechanics, how the spine moves, and dry needling, laser cupping, that's not going to fix that condition or restabilize it. So what does? This is where chiropractic excels. Chiropractic is your best option in these scenarios. That's why if you start to look at the research on treating low back pain, neck pain, where they compare chiropractic to PT, to yoga, to placebos, chiropractic is by far your best option because chiropractic exclusively knows how to adjust or start to change the alignment and mechanics and motion of the spine, which helps restabilize those ligaments. When you have an injury to the ligaments of your spine, that causes a derangement or a change in the neurology in those ligaments. So your ligaments are full of nerves. They're called mechanoreceptors. And those nerve receptors help your brain know the positioning of the spine. But when those are injured, you're getting improper or negative feedback from those nerves. And the nerves in the ligament have a loop that goes right back to the muscle on top of your spine. So your back muscles are talking to the ligaments underneath that are connected to the spine, that are part of the spine. And so an injury to the ligament, a derangement to the ligament, impacts the nerve. That nerve is then telling that muscle to spasm or lock up or become more flaccid. And so these therapies of dry needling, cupping, whatever it may be, cold laser, they're treating the muscle. They're not treating the underlying cause. Sometimes people come to me and they think they have a muscle issue. They say, hey, doc, I think it's just a muscle issue. The muscle's tight. Well, muscles are only doing what nerves tell them to do. And so some of those therapies, they feel therapeutic, maybe in the short term. They help you feel better, but they're not fixing the underlying cause. As a chiropractor, I can do all those therapies. We can offer them here in our office. Most people don't realize that chiropractors are trained in all those therapies as well. Most of us just don't do them because we know the benefits just aren't there long term. So that's why we don't do them. Also, when it comes to correcting these problems, once you begin to correct the mechanics, so how the spine is moving, how it's aligned, and those ligaments can become healthier and they can heal, that's helping your nervous system get healthier. What you want to do then is begin to strengthen those areas. So strength training is fantastic for chronic pain. Anybody who's had chronic low back pain knows that lifting weights the proper way really helps them feel much better. So strengthening these areas is going to help as well as movement. So in my office, we have a 3-point process. We're going to treat the patients with a very precise type of chiropractic care that I do here in my office called torque release, where we're using an instrument. I'm not manipulating and cracking people's backs, as you may see on other videos. But then we get our patients moving and we get their joints and their back stronger. That's how you rehab and get out of chronic pain. The last aspect of treating chronic pain, which most doctors are just bad at, is managing your diet. The course of my career, I get to have good conversations with colleagues and medical doctors, and all doctors, but specifically medical doctors, always tell me they have no nutritional training, maybe 2 or 3 hours. So a lot of patients are upset that their medical doctor just doesn't talk to them about their diet or maybe supplements, and it's just the doctor isn't trained on. That's just the nature of it. Chiropractors get a lot more training than medical doctors do, and most chiropractors, after graduation, we do further training. So I've done even more advanced nutritional training after I got my doctorate. I did more nutritional training to understand how the diet affects inflammation and chronic pain that most doctors just don't have. And so managing inflammation is also very important in treating chronic pain. for everybody watching this, I can give you general advice that if you do, you'll get better. Your pain levels will go down. One, just stop eating food that you know you shouldn't. You know, the sugary foods, the alcohol, the sodas, the donuts, the fast food, just stop eating it. You'll feel significantly better. Secondly, pay attention to how you feel after you eat something. If you ever notice that you become bloated, if your skin becomes itchy, if it gets harder to breathe, but specifically the bloating, a lot of people bloat after they eat, and that's a sure sign you're creating inflammation within your bowel. Inflammation always starts in the digestive system, and then that's what causes the reaction throughout your body and causes chronic pain. So don't eat food you shouldn't. Don't eat anything that bloats you. And then eat foods that support lowering inflammation. Most people are low on omega-3, so fish oil, cod liver oil, you could start doing right away. Most people aren't drinking nearly enough water. Just drink a lot of water. You don't necessarily have to measure it. Just whatever for you is more, start getting more. Try and just drink a lot of water where you need to use the bathroom or urinate more frequently. That's a good sign that you're getting enough water. So, there's many reasons the medical profession is just bad at managing chronic pain. The worst options are always drugs and surgery. Now, I know there's some scenarios where maybe that's appropriate, but for the vast majority of people that I have found that use drugs and surgery to manage chronic pain, they typically never get better. They begin to plateau, and as they add in more drugs and more surgery, they get worse and worse and worse. Now, again, there may be some conditions where that's the only option. The thing I worry about with drugs or surgery is when people go to that first, or maybe they don't explore what a chiropractor does, or they don't come and see me first to see if we can get them better without the drugs or surgery, because in most cases we will. But if you or someone you know has gone down that path of surgeries, of medications, then you know for yourself, in most cases, those people are just getting worse over time. Yes, there are some successful cases. Yes, there are times where that's appropriate, but the vast majority of the time, drugs and surgery just lead to more chronic pain. They're not fixing anything, and they lead to more cost down the road. The last thing with chronic pain, where it costs you is your life. It affects your ability to work, to have fun, to sleep, your energy levels. And that's why getting the right diagnosis is extremely important to understand the underlying cause. So if you're in the Milwaukee area and you're struggling with chronic pain, I would recommend you come to my office, schedule a consultation so we can evaluate your spine to see if you have an underlying condition to your spine or to the ligaments of your spine that are the cause of your neck pain, cause of your headaches, cause of your low back pain or sciatic pain, because we get really great results with that and we can help you live a much better life. When you go the natural route, obviously it's safer, but you typically get better results and you're not going to have all the dangerous side effects that drugs and surgery provide for you. So if you need anything, give us a call or schedule a consultation on our website. You can find all that information attached with this video. Leave some comments below, follow us. I'd love to hear your reaction to this video, and take care. We'll see you on the next one.